I talk about bowel movements all day long in my clinic as a pediatrician. How often should babies have bowel movements? What should they look like? We're going to answer all of those questions in this video. My name is Dr. E. If you're new here, I am a board certified pediatrician and I'm also a new mom. I aim to make fun and informative videos here on YouTube. You can also find me on Instagram and TikTok. My username is the primary pediatrician on all platforms. Today, we're gonna dive into the world of bowel movements. So this may not be the most exciting topic, but it's probably, if not the most, one of the most common things that I talk about with with families and their newborns all day long. So this is questions that come up constantly, even in older kids. Parents always have questions about bowel movements. So we're gonna go over more of the newborn bowel movements today. We're gonna talk about what dirty diapers should look like, how many there should be. If you have additional questions that aren't answered in this video, I would love if you'd leave a comment below. Also, you can send my channel to a friend you think might find these videos helpful. All right, let's get into talking about bowel movements. So going all the way back to the very beginning, a newborn usually has a bowel movement within the first 48 hours of life. It's actually a hospital criteria that a newborn cannot be discharged from the hospital until they have their very first bowel movement. If you've been around newborn babies or you've had your own, you'll know that that very first bowel movement that a baby has is really sticky and it's black and it's called meconium. So this meconium is just stool that's been in the baby's belly while it's been in mom's belly and it's finally coming out. So there's actually a chance of your baby having this bowel movement while still inside of you. And so that can kind of change the color of the fluid the baby is surrounded by and can lead to some different health problems as well. I won't dive into that in this video, but just so you know, that's called a meconium aspiration. If you're interested in this, I can definitely make another video, so you can comment down below about it. So while a meconium aspiration is not a good thing, having meconium is a good thing because it means everything is moving through the GI tract and baby is flushing things out and getting ready to take on the nutrition of formula or breast milk or whatever baby is eating. It's really important that babies have that stool or that bowel movement within the first 48 hours of life. So hospitals will not discharge baby until they have that stool. Baby stools don't stay meconium forever. Usually at day 2 to 3 of life, once their intake of breast milk or formula has really increased, their stools will transition. So that's a really good sign for a breastfeeding mom, especially an exclusively breastfeeding mom, when their baby's stools start to transition, because it means that baby's getting enough. It's hard to tell how much a baby is getting when they're breastfeeding, so this is something that we look for as a pediatrician to be reassured that they're getting enough nutrients. Now, there's no real normal amount of stooling for the first few weeks of life. It kind of depends on different babies and their different habits. Typically, babies will have that very first stool within the first 2 days of life, and then after that, usually they will have a lot of stooling, usually with every single feed. However, that's not always the case, but usually in the first few weeks of life, babies are stooling a lot. There's a lot of dirty diapers. Once baby's intake becomes more regular and consistent, the stooling pattern can actually vary a lot. There's a study in France done back in 2015 that looked at breastfed infants and formula-fed infants and their stooling patterns. It suggested that breastfed babies stooled a lot more frequently than formula-fed babies. However, it also said that breastfed babies were more likely to go longer between stooling, which is kind of contradictory. So I'm mentioning this because stools are very, very variable. So there is no consistent amount of stooling. There is no right amount of stooling and wrong amount of stooling. And even when we do a study to look at bowel movements, it's still all over the place. So I wanted to use this study to drive home the fact that there is no normal. What's normal is whatever your baby typically does. So a lot of times babies will get into a nice routine, and usually, you know, as mom and dad or whoever the caretaker is, will kind of get into this routine too. So a change in your baby's bowel movements would be something to note. So a lot of times changes in bowel movements and their frequencies can happen frequently, especially during the first year of life. babies are having so many changes, and so it's not immediately a sign of concern if your baby suddenly starts going a few days between bowel movements or a week between bowel movements even. So while we can't really monitor for a normal stooling pattern, we can monitor for things that are abnormal about the stools. Things that would be abnormal would be anything that looks like blood in the stools. Now, I will say, as your kids get older, sometimes eating different foods with red food dye or beets and raspberries and strawberries, sometimes those foods can change the color of baby's poops. So with all of that aside, if there's anything that does look like blood in your baby's poop, it's important to talk to your pediatrician right away. Also, any bright white colored poops, so if the solid poops are bright white, would be something for immediate concern as well. And then also that dark black poop after your baby's poop is already transitioned. So if their stools have gone to that nice seedy yellow and then become dark black again, that would be something that is important to bring to your pediatrician's attention. I have a lot of parents who come into clinic saying that their baby is constipated. Now we're talking a week old, a 3-week old, and most of the time that is not the case. So while it may seem like your baby is constipated, babies can often get really red when they're stooling. They can start grunting, or they can look like they're pushing really hard, and it can look like constipation. And that makes sense because they're flexing all of those muscles that you use for stooling, and so it makes sense that they look constipated. However, that's not what your baby is experiencing. What your baby is doing is trying to coordinate all of the muscles that they use to stool, and they're really trying to figure out how to coordinate all of the muscles together. So you'll see flexion of their abdominal muscles. A lot of times you'll hear grunting, or their face will get really red. All of these are just kind of them trying to figure out the muscles of their abdomen and which muscles do what. They've only been alive for a few days, so it makes sense that they're still trying to figure everything out. This actually has a medical name. It's called infant dyschezia, and it's super, super common. My baby had it. Most babies have this just because it's their physiologic need to figure out how to use their muscles. Now, usually this will resolve somewhere between 6 to 8 weeks of life. A good way to differentiate between true constipation and something else is if the actual stool is hard, dry balls of stool. So if the stool is nice and soft, it's not constipation, it's something else. Now, if you've identified constipation, say your baby is having hard balls of stool, usually this won't happen until babies are a couple months old, or a lot of times if they are on a formula that causes them to be a little constipated, or if they start solids. Sometimes rice cereal can be very constipating to babies, or other solids that can cause that. So if you do identify constipation in your baby, they're having those hard balls of stool, what can we do about it? How do we fix it? There's a lot of over-the-counter medicines that we can use for constipation. However, in these little young babies who are only a few months old, I'm very hesitant to recommend any type of medicine, especially when we have natural options that work really well. Offering your baby a little bit of prune juice, a little bit of apple juice or pear juice can be really helpful to alleviating constipation. I don't recommend doing this in babies less than 4 months old, but once babies are over 4 months, they can have a little bit of that juice, or even just the actual peaches and pears cut up really, really small. All of these foods help to move things through really nicely and can alleviate the constipation. Do you have a funny story about infant dyschezia? Do you have any other comments or questions about treatment of constipation? Leave a comment below and let me know. Thank you so much for watching this video. I'm having so much fun here on YouTube talking with all of you. Don't forget to subscribe to the channel, and I'll see you next Wednesday. Bye!